It can affect us in numerous ways, but especially those people who have underlying chronic conditions, especially lung conditions, it will exacerbate their condition. These are very small particles. The air quality index is a measurement of particulate matter. So these are very, very small particles that are so small they get past our filters of our nose and mouth and upper airway into our lungs and can induce an inflammatory response. And we manifest that as wheezing, cough, shortness of breath. We can all feel it. We may all feel the dryness, but it's those patients with underlying lung disease, chronic conditions, but even underlying heart disease can be impacted. So this particulate matter can actually induce inflammation systemically, actually in the bloodstream, which can lead to cardiac events, arrhythmias, chest pain. So those patients who have underlying heart disease we're also concerned about as well. The impact of this small particulate matter getting into the bloodstream, especially in pregnant women, there's concern that that could potentially impact the fetus. Obviously, when the air quality index goes way high into the unhealthy range, really none of us, whether we're older adults or young kids, should be out exercising. And the reason being is when you're exercising, you're taking in a lot more of this particulate matter. So it's just increasing your exposure. Not only do we ask those patients who have underlying lung disease or heart disease to limit their outdoor activities, but we'll actually recommend that all of us try to limit the amount of outdoor activity. It doesn't mean you can't go outside, but to be doing sporting events, a lot of outdoor exercise. When the air quality really deteriorates to that matter, we will say stay indoors, run your air conditioner, try to limit the driving, again, because when you're driving, especially if your windows are down, you're bringing in more of this particulate matter. So that's the time to roll up the windows, use the air conditioner. That little button on your car that says recycle the air as opposed to bringing in from the outside, that we all look at that and we don't punch much all the time. That's the time to use it. We often, in the pulmonary department, will recommend masks for exposures in woodworking and other things. But for this type of small particulate matter, these type of really paper-type masks have no benefit. You really have to find a mask that will filter out the very small particles. And the only ones that can do that are these ones that are described as N95 or N100. The other aspect that people don't appreciate about these masks is that they really need to be able to be well fit. So you have a beard, it's not going to be effective. You'll pull in those particulates around where it doesn't seal. And some just facial contour won't fit to this. So within the hospital, when we use these, we are all fit. They are fit to our face. These masks are a bit fragile, so as long as they are well sealed and they don't deteriorate and you've been fit to them, it may be something that would be helpful to have on hand. One thing I need to stress, though, is that these are very strong filters. So if you have underlying lung disease, it can make breathing through the mask quite difficult and actually can create problems for those folks with, for instance, severe chronic obstructive pulmonary disease or asthma. They'll actually feel more short of breath with them just from the work of breathing. So they're not for everybody. Well, I think any protracted lung symptom, protracted cough, wheezing, shortness of breath, I think should prompt a call at least to your primary care provider. Those of our patients who have underlying lung and heart disease, I think if they start noting symptoms that they're probably familiar with from their underlying lung or heart disease, whether that's shortness of breath, cough, chest pain, to alert their provider would be advised. This is an important health issue, no doubt about it. But this is in general, a time-limited exposure, and if we can follow those recommendations, most people will do just fine. However, it could be a recurring exposure. So I don't want to create mass hysteria that this is going to create long-term problems.